Dr. S.M Balaji is a well-known dental surgeon in India and a specialist in facio-maxillary surgery. We'll tell you what facio-maxillary is all about a little later. Dr. Balaji is a consultant to 4 major hospitals in Madras and has won many awards for his extensive work in this field. Dr. Balaji, it's a pleasure to meet with you. Welcome to Sri Lanka, and tell me what brought you to Sri Lanka this time.
This is purely a personal visit, and I was invited by my Sri Lankan friends whom I have operated in Madras, and they welcome me with open arms, and I am really touched by the love and affection shown from the Hotel Galadari where I stay normally.
Right. I just mentioned the term facio-maxillary surgery. What is facio-maxillary surgery?
Facio-maxillary surgery is a branch of dentistry which deals with the surgical correction of the dentofacial deformities. Look at this girl. She has got a lockjaw where she can't open her mouth due to forceps delivery. I have done a gap arthroplasty and opened her mouth. After that, I have pushed her upper jaw inside and brought her lower jaw forward. Now she looks nice. This boy has a long lower jaw, which I have made it short so that it corresponds his upper jaw. The same procedure has been done for this boy too. This girl's lower jaw was too prominent that only her lower teeth were seen when she smiles. For her too, I have reduced the length of the lower jaw. He is a case of long face syndrome where the angle of the lower jaw was very steep and gives a lengthy look to his face. You can see the massive change after the surgery. She is a young girl with bimaxillary protrusion with thick lower lips. She had an inferiority complex because of her appearance and could not move well with her friends. For her, I have pushed both upper and lower jaw inside and also thinned her lip. This is a case of short upper lip where I have taken the entire upper jaw upwards and inside. It's called Lifort 1 osteotomy with superior positioning. This boy had worn a clip for more than 2 years and his condition did not improve at all. I have pushed his upper jaw inside and got an excellent result after the surgery. This is a case of short upper lip and deep bite where her lower teeth were hitting too much inside. I have lifted the upper jaw up and created a good lip seal. This young girl was not satisfied with her profile, but she was not looking so ugly. So I just pushed her upper jaw inside a bit and the lower jaw. Now she is satisfied with her appearance. This boy had a protruded teeth and he was refusing to go to the school. The parents had a difficult time, and after the surgery he is comfortable. Now his friends, they don't mock at him. He goes to the school. Some people will have a long lower jaw or a short lower jaw or a long upper jaw. All this correction is called facio-maxillary surgery.
So what type of cases do you see every day?
Every day I find some people with protruded teeth and some people with a long lower jaw or facial asymmetry and the open bite and cross bite and so on. You know, many type of cases I see come across.
You just mentioned protruded teeth. What is the latest treatment for protruded teeth?
See, the protruded teeth is of 2 types. One is the dental protrusion, where you find only the forward jetting of the teeth, and the other one is the skeletal protrusion where there is the protruded teeth along with the growth of the excessive growth of the upper jaw. So the dental protrusion can be corrected with the fixed orthodontic, the clips,
right,
the basic
yes,
clips.
Yes.
And the skeletal, you really need a surgery where you have to break the jaw, reduce the size and fix it with plates and screws. These patients will have their own jaw, their own teeth. They can bite normally after the surgery. They eat normally after the surgery.
I see. Doctor, say you take a person with who has a gummy smile. What sort of a treatment would you give
It's
for a
a
person like
very
that?
good question there. See, gummy smile. Some people will think, though they have a gummy smile, they think they have a protruded teeth. No, it's wrong. Their teeth is normal. The alignment is normal. But whenever they smile, the gum is seen because of the short upper lip.
I see.
Their upper lip is short. So these cases cannot be corrected by clips. This is a wrong idea the people will have. Their teeth is protruding. So these cases, what we have to do is we break the jaw and reduce the vertical height of the jaw and push it up and fix it with plates and screws.
I see.
Again, nobody can lengthen the lip. It's not possible to lengthen the lip. So once you break the jaw and reduce the vertical height and fix it up, the lip automatically falls down and they have a normal smile. And same surgery, I can show a live surgery on the screen.
Right.
You can see the difference of the face now, how comfortably she is closing.
Doctor, now how do you treat a long lower jaw?
This is also a common condition where you can find many of the children with a long lower jaw. This long lower jaw, either they will have a open bite or a cross bite. Whenever the person bites, only the last teeth, the posterior most teeth, come in contact, and they can't chew properly because their front teeth, they don't come in contact. And another condition where the jaw will be deviating towards another side, and it's called cross bite. All this can be corrected by a sagittal split technique where I cut the jaw in the back portion and reduce the length, and all these surgeries are done inside the mouth, and you don't see a scar outside, and they can perform their duties normally, and they have their own jaw and the teeth.
Now there are people with a small lower jaw. What is the reason for it? What are the causes?
Yeah, this is very important actually. Like the short lower jaw or a small lower jaw is called micrognathia. The long lower jaw is called macrognathia. So micrognathia can be of congenital, it's from the birth, or it can be heredity, like passed on from the forefathers,
Right.
or it can be acquired. Acquired is very important, the etiology, the cause for this is very important. Like any infection in the joint area, the jaw joint, it's called the temporomandibular joint. See, the jaw joint, it's very peculiar. You have two joints and the one bone moving all the time.
Right.
The joint moves whenever you eat or speak, all the time this moves. And this joint is forming the growth center, the ossification center. What happens in childhood? If the child falls down, the injury is here on the symphysis, on the chin. All the force is transmitted to the joint here. This joint is highly vascular, full of blood supply. And in childhood, when the injury happens here, the joint becomes a mushroom, like a mushroom. The highly vascular joint becomes like a mushroom. And the entire joint becomes a big blood clot, and the blood clot becomes bone.
I see.
This bone fixes the jaw to the skull bone. So the child cannot open, first point.
Right.
The second is because this affects the condyle of the joint, it retards the growth of the jaw. So the jaw becomes small. Again, they get a typical micrognathic. Other causes are like infection. Like in villages, you can see the children with ear infection, all the time they'll have some pus discharging from the ear.
Yes.
Nobody bothers about it. These chronic otitis media, this can also cause the infection into the joint and retard the growth. These children will have a typical bird face. The jaw is small, the upper jaw protruding, they'll have a bird face. We call it a bird face syndrome, Yeah.
Now take a child who cannot open the mouth to
Jaw to the skull,
Right.
that bone is removed. That procedure is called gap arthroplasty. I can't leave it like that because already the child is having a growth problem. So we have to transfer a growth center. Transplantation of a growth center is very essential. So normally we take a piece of rib, the rib costochondral junction, that is the place where the cartilage and the bone joins. Rib has a character. Even if you harvest one piece of rib, it grows again in childhood, you know. So that portion of the rib is taken and it is kept in the joint area after the gap orthoplasty, so the jaw grows.
Right.
And when they come in the adulthood, a chunk of bone is removed, gap orthoplasty, and the mouth is opened. And you know, now the problem is re-ankylosis. The first, you know, again they go for ankylosis again. Again the jaw gets fixed. So you have to transposition a muscle from the temple. This is called temporalis muscle transposition.
Right.
So the muscle, a piece of muscle with the blood supply, is taken from the temple and transferred into the joint. This prevents re-ankylosis, and these people can comfortably open and eat, you know. So their difficulty in opening the mouth is solved.
Right.
This is a 7-year-old girl with jaw joint ankylosis. She cannot open the mouth. The right side of the joint is fused to the skull bone. Due to the removing the excess bone, the mouth can be open.
Doctor, I have often seen these hair lip children, you know, and it's fairly common. Yes. What are the latest treatment modalities for a hair lip children?
See, this is a very good question, you know. This is very important, which the world is now facing. Actually, in Scandinavia, the Scandinavian countries, they have separate villages for these kind of children.
Really?
Yeah. And these children they're all in the villages, they have their separate schools. And these hair lip children, I'm not saying that the treatments were not done. It is done in our country, especially in India and Sri Lanka, it is done. What the surgeons were doing, they were doing the soft tissue repair. That is, the lip is closed or the palate is closed.
Right.
Nobody were bothered about the bony deformity inside. So, when the child is born, when the baby is 2 months old, we have to check the blood, the hemoglobin. If it is around 12 grams percentage, then we can take the child for the surgery. The child is born, the problem is the child cannot suck and drink the milk because the lip seal is not there.
Right.
So first point, we create a lip seal by the lip surgery.